Hello, my name is Daphne Onifade. I will be presenting my practicum quality improvement project titled Reducing Blood Culture Contamination Through Evidence-Based Education in the Emergency Department. I completed this project in Centera Emergency Department with my project mentor, Dominique Duval Hill. This project aimed at developing, implementing, and evaluating an educational program to enhance blood cultures collection process and discourage blood cultures contamination. In this presentation, I will talk about the background of the project, the process of implementation, the results, recommendation, and my professional development from this experience. Next slide. Blood cultures are important because they help care providers diagnose infections in the bloodstream and determine the best way to treat them. If blood cultures become contaminated, patients may be prescribed unnecessary antibiotic, thereby impacting treatment decision. Additionally, contamination impacts the cost of healthcare and can lead to prolonged hospital stays as further testing may be needed. Emergency department a hectic workplace where interruptions, workload pressure, and time demand can elevate contamination risk. Minimizing contamination reduces patient risk and helps to deliver high quality care. The purpose of this practicum project was to try to minimize contamination of blood cultures by educating staff. The education program was created for emergency department nurses at Centera Princess Anne Hospital. The project was directed at gaps in knowledge and proper blood cultures collection. The activity they worked on involved creating educational resources, conducting educational sessions, and surveying and gathering feedback from staff to assess the effectiveness of the program. The literature reviewed identifies several evidence-based strategies for reducing the contamination of blood cultures. Staff education was found to enhance the knowledge of staff and led to better collection practices, contributing to the reduction of contamination rates. Research also showed that standardization of procedure enhances specimen quality and patient outcome. Proper skin preparation before collection reduces contamination risk. Staff ensures they are maintaining compliance with recommended procedures for collecting these items through ongoing feedback and monitoring. Centera's current policy stipulates that nurses must use aseptic technique to collect blood cultures. Proper hand washing, proper hand hygiene is also needed prior to starting specimen collection procedures because it helps to prevent contamination. Staff should leave chlorokidine on the skin until dry to allow for effective antisepsis of the skin. Standardized procedures minimize contamination and enhance specimen qualities and patient safety during collection. Staff feedback reveals that there are some barriers to the collection of blood cultures. Nurses stated that the burden of work sometimes poses a challenge to carefully collecting information, which aligns with findings from emergency department studies. Interruptions in workflow cause loss of concentration and impact the consistency of procedures. Nurses' capacity to perform all recommended collection steps was tested during the limited time they found themselves with during busy shift. Staff should also ask for more training, feedback, quick reference guide as suggested by Globerg. Variations in collection practices indicated a need for uniform education and reinforcement across the department. The educational intervention focused on preventing contamination through adequate and correct collection of blood cultures. Learning objectives were purposely developed to enhance staff knowledge, confidence, and consistency of collection procedures. Educational content included hand hygiene, skin aseptic and septic techniques, collection practices. I went back. Okay, sorry. I think I gotta go back one. All right, sorry. And it's a aseptic collection practices that align with national recommendation. Practical information was recommended by the project mentor relating to barriers identified by the staff. Educational materials were incorporated with quick references guide, checklists, and review questions that reinforces important concepts and aid learning. The education program was offered during specific shifts after ED to maximize participation. There were 13 nurses who attended the education sessions and took part in discussions and learning activities. The project mentor was involved in the sessions and supported during the project implementation. Quick reference guide, checklist surveys, and knowledge assessments were included in educational material. The program lasted for 2 weeks. There is evidence that a similar educational program enhances collections in ED. Survey results indicated that the participant had an increased awareness of blood culture contamination prevention practices. The education program led to an increase in the confidence of most nurses in carrying out proper collection techniques. The rapid reference guide was found to be easy to understand, informative, and clear to use in the educational material. Fewer participants indicated that the study did not have an impact on their awareness of evidence-based collection practices, which agrees with previous studies on quality improvement. Staff suggested further continuing education sessions and competency audits to ensure ongoing improvement and consistency. A number of recommendations were formulated from the project findings and staff comments. Staff should be kept up to date on contamination prevention practices and should be reinforced through regular educational sessions. An annual competency review can be used to maintain the consistency of blood cultures collection procedures. Providing contamination information to staff help to hold people accountable and can drive quality improvement efforts. Ongoing support is given through quick reference guide during patient care activities. Minimizing contamination enhances patient safety and strengthens professional nursing practice. And these are my references. Overall, the practical goal was met by successfully developing, implementing, and evaluating the educational program. The project helped me gain knowledge on evidence-based nursing practices and quality improvement techniques. This experience enhanced my leadership, teaching, communication, and project management abilities. Healthcare practices are always evolving, so it is important for lifelong learning. Moving forward, preventive measures should be kept in place, including continuing to encourage patient safety, which has been supported by recent quality improvement research. That's the end. I'm gonna stop sharing my screen.